While we battled the Delta variant surge this past fall, our staffing shortfalls for medical professionals was of grave concern to all of us. My administration acted last August before the surge fully hit, when we took decisive action after receiving notification that healthcare workers were available. We consulted with the State Hospital Association to identify their needs and secured nearly 500 contract specialists, from nurses to respiratory therapists. After finalizing the contract in September, it took less than a month for us to deploy these workers around the state to our hospitals, nursing homes, and Department of Corrections, just in time to deal with this surge. Again, good policies and decisive action can make all the difference. We brought the needed resources to bear to reinforce our hospitals, but we recognize temporary workers are not a long-term solution. We now have 3 initiatives to address the shortages we've identified in our healthcare workforce. First, we're working with the Board of Nursing and the State Hospital Association to recruit and retain over 600 certified nursing assistants. This is a huge accomplishment, achieved in a very short amount of time, to boost our healthcare workforce for the long term. Second, we've issued a $2.1 million grant to the University of Alaska Anchorage Nursing School to recruit and retain additional faculty to train and graduate more registered nurses for Alaska. Third, my administration's FY23 budget includes a 50% increase to the number of students in the WWAMI program. If approved by the legislature, we'll go from 20 seats to 30 seats at the University of Washington School of Medicine to train doctors for Alaska. Together with these partners, we'll build a stronger, more durable healthcare system in Alaska that can respond to almost any situation. Every state, every nation has been confronted with this pandemic and its periodic surges as new variants emerge. But make no mistake about it, we've been very different from any others in how we've responded, and our outcomes prove it. We've led on testing. We've led on vaccine distribution. We've led on the distribution of therapeutics, such as monoclonal antibodies, as the first state to establish a community site to receive treatment. We recognized early on that specific populations were more vulnerable to the virus than others, particularly our elders, those with underlying health issues, and some residents of our remote communities with limited healthcare infrastructure. From the beginning, I was determined that there would be no repeat of 1918 on my watch here in Alaska. By any measure, history will reflect that our actions helped us achieve some of the best outcomes in the nation. The data speaks for itself, and it's irrefutable.